Today we will discuss introduction to upper limb sports injury, a very important topic for your examination point of view and clinical practice. In this lecture, we will understand what upper limb sports injury are, why upper limb is important in sports, common sports injuries, risk factors, pathophysiology, clinical presentation, basic principle of management, and finally, the role of physiotherapist. Important point to remember also. Definition: upper limb sports injuries are injuries affecting the shoulder, arm, elbow, forearm, wrist, and hand that occur during sports activities due to acute trauma or repetitive overuse. They commonly involve muscle, tendons, ligaments, joints, bones, and neurovascular structures. The importance of upper limb in sports. The upper limb play a vital role in many sports activities such as throwing, hitting, lifting, catching, and even weight bearing activities like gymnastics and boxing. Because of high mobility and repetitive use, especially at shoulder joint, the upper limb is highly prone to sports injury. Common sports associated with upper limb injuries. Upper limb injuries are commonly seen in cricket, tennis, badminton, volleyball, baseball, swimming, boxing, and weight lifting. Now, the classification of upper limb sports injuries on the basis of onset. We can divide it into two types: acute injuries and overuse injuries. In the acute injuries, these occur suddenly due to trauma like shoulder dislocation, fractures, muscle tears, ligament sprains. In the overuse injuries are rotator cuff tendonitis, tennis elbow, shoulder impingement syndrome, and bursitis. On the basis of structure, muscle injuries, tendon injuries, ligamentous injuries, joint injuries, bone injuries, and nerve injuries. By this table, you will knowing the acute and overuse injury according to site. Like in the bone, what can be the acute injury or you overuse injury? In articular cartilage, what can be the acute injury and overuse injury? In joint, in ligament, muscle, tendon, bursa, nerves and skin also. Most common upper limb sports injuries are rotator cuff injuries, shoulder dislocation, shoulder impingement syndrome, tennis elbow, or we can say lateral epicondylitis, golfer's elbow, or we can say medial epicondylitis, wrist sprain, scaphoid fracture, and so on. In this picture, you see there is prominent acromioclavicular joint or acromion prominency, flattened shoulder, humeral prominent, arm is slightly abducted, elbow flex, and forearm internal rotated, supported by other hand. This is typical presentation of glenohumeral joint dislocation. Now, what will be the risk factor for upper limb sports injury? We can divide risk factor into type intrinsic factors and extrinsic factors. Intrinsic factors are like muscle imbalance, poor flexibility, previous injury, and poor posture. In the extrinsic factor, repetitive overhead activity, poor sports techniques, inadequate warm up, improper equipment, or over training. Pathophysiology of sports injury, especially repetitive microtraumas, leads to inflammation. If proper rest and healing are not provided, this leads to degeneration. Continued stress result in chronic injuries. That is why overuse injuries are more common than acute injury in athletes or sports person. Now, the clinical feature or clinical presentation are pain during activity, swelling, reduced range of motion, muscular weakness, functional limitation. Pain often increase with sports specific movements. Basic principle of management. The basic principle of management includes early diagnosis, proper rest and protection, medical management, physical rehabilitation or physiotherapy management, gradually return to sports. Role of physiotherapist in upper limb sports injuries. The role of physiotherapist in upper limb sports injuries. First, physiotherapist should do proper injury assessment. Okay. Then pain management, restoration of mobility, muscle strength, injury prevention strategies, and then return to sports training. In this picture, you can see this is not the correct way to throwing ball. This is the correct way of throwing ball. In also this picture, this is not the correct way of throwing ball. This is the correct way of throwing ball. Important point to remember: shoulder is most commonly injured joint in the upper limb in sports. Overuse injuries are more common than acute injuries in the upper limb especially. Rotator cuff injuries are common in over athletes. Early physiotherapy can reduce reoccurrence rate. Thank you to all.